Aetoxisclerol uses, indications, contraindications, and precautions. Aetoxisclerol 2 is a medication used to treat small, uncomplicated spider veins and varicose veins in the lower limbs. It comes in the form of an injectable solution, packaged in 2 ml vials, each containing 40 mg of the active ingredient Lauromacrogol 400. Each box contains 5 vials. 1. Introduction to Aetoxisclerol. Aetoxisclerol 2 is a medication used to treat small, uncomplicated spider veins and varicose veins in the lower limbs. It comes in the form of an injectable solution, packaged in 2 ml vials, each containing 40 mg of the active ingredient Lauromacrogol 400. Each box contains 5 vials. 2. Mechanism of action. Aetoxisclerol is a sclerosing agent. When injected into a vein, it causes inflammation and irritation of the vein wall, leading to the vein becoming blocked and shrinking. 3. How to use. Control and monitoring. Administration of Aetoxisclerol should only be performed by a qualified physician experienced in the procedure. They must use Doppler ultrasound imaging to guide and control the injection throughout the procedure. 3. How to use. Advantages of Doppler ultrasound. Besides aiding in the injection process, Doppler ultrasound allows for immediate and long-term assessment of the effectiveness of the sclerosing treatment. It can also help to detect any underlying deep vein thrombosis (DVT) complications. 4.1 Indications. Small, uncomplicated spider veins with a diameter less than 3 mm. Varicose veins in the lower limbs. Dilated veins in the legs and ankles. 4.2 Contraindications. Varicose veins with a diameter larger than 3 mm. Patients with known hypersensitivity to any component of the medication. Patients with infection or inflammation of the skin at the injection site. Pregnant or breastfeeding women. Patients currently taking anticoagulant medications. 4.2 Contraindications. Patients with severe cardiovascular, liver, or kidney disease. 5 Side effects. Common side effects: pain, swelling, redness, warmth, and itching at the injection site. Rare side effects: deep vein thrombosis, skin inflammation, skin necrosis, and worsening varicose veins. 6 Precautions. Aetoxisclerol is not a definitive treatment for varicose veins, and its effects may not be long-lasting. Patients must adhere to the physician's instructions regarding dosage and administration. Do not self-administer the medication without a physician's prescription. 6 Precautions. Patients should report any side effects experienced during treatment to their doctor. 7 Storage. Store Aetoxisclerol at room temperature, away from direct sunlight and moisture. Keep out of reach of children. 8 Conclusion. Aetoxisclerol is an effective treatment option for small, uncomplicated spider veins and varicose veins in the lower limbs. However, patients must follow the physician's instructions and be aware of potential side effects. 8 Conclusion. Note: this information is for reference only and should not replace the advice of a qualified medical professional. Patients should consult with their doctor for proper diagnosis and treatment. Additional information: Aetoxisclerol is a relatively safe and effective treatment for varicose veins when used correctly. Additional information: it is important to note that there are other treatment options available for varicose veins, such as laser therapy, sclerotherapy, and surgery. Your doctor will help you determine the best treatment option for you based on your individual needs and medical history. Additional information: after receiving treatment with Aetoxisclerol, it is important to follow your doctor's instructions regarding aftercare. This may include wearing compression stockings, avoiding prolonged standing or sitting, and elevating your legs regularly. Additional information: if you have any questions or concerns about Aetoxisclerol or any other varicose vein treatment, please speak to your doctor. They can provide you with the most accurate and up-to-date information about your condition and treatment options.